Welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, the Educational Programs Coordinator for MS Focus, and I'm joined by Dr. Susan Payrovi, who's going to be spending the next 60 minutes answering your questions about nutrition and supplements for MS. We're going to have a town hall type of Q&A, so you can ask any question you want, and if she's able to answer it, I'm sure she will. So, okay, let me introduce her. Dr. Susan Payrovi is a physician practicing integrative and functional medicine at Stanford University, specializing in the treatment of complex chronic conditions such as autoimmunity, cancer, gastrointestinal disorders, and chronic fatigue. Initially trained in anesthesiology, Dr. Payrovi shifted her career after being diagnosed with multiple sclerosis shortly after the birth of her first child. This diagnosis led her to explore new areas of medicine, primarily to improve her own health. We're so pleased to have her again to speak about this important topic. Dr. Payrovi, thank you. Thank you so much for coming again, and I'm going to turn it over to you. Let's just see if anybody has any questions. For those that haven't joined us before, um, if you have a question, please put it in the Q&A app. Do not put it into the chat area. We're going to leave that for something different. So please try to remember to put them only into the Q&A area, and I'll grab them from there. If you are on a phone, you can hit *9, and that's going to raise your hand, and I can always unmute you. And if you are on the computer, just go ahead and say that you'd like to do a live question, and we'll unmute you for your question. So let's see. Let's go to this. We do have one question. I have heard of gluth glutathione can help with MS symptoms. Is this true?
This is a great question. So, glutathione is an antioxidant. And what do antioxidants do? They actually protect our cells. So, there's a lot of stressful things that can happen in the cellular environment. Sometimes it's because we have an infection, or there's exposure to a toxin, or we're just digesting food. All of these things can actually throw off stressful molecules, and we use our antioxidants to minimize the damage from these reactive molecules that can be damaging to cells, proteins, and DNA. So, glutathione is one of our body's main antioxidants. We actually make it from the building blocks of protein. And those are amino acids. It usually takes cysteine, glutamic acid, and glycine. These are the breakdown building blocks of protein. And we can make our own glutathione. So, where do those things come from? They come from diet. So, boosting our antioxidant status by eating more protein can definitely be helpful. But you can also get glutathione from a lot of plant-based foods, lots of green leafy vegetables and many plant-based foods. So, does glutathione help with MS symptoms? I would say it's not a direct treatment, but what it's actually doing is it's lowering oxidative stress. It's like cleaning up the mess that can happen causing cellular stress. And for that reason, it can help lower inflammation, bring a lot of different systems back into place. So, my favorite way of getting glutathione is through diet. There are glutathione supplements, and companies have done lots of fancy things to help glutathione get absorbed into the body when you take it orally, but it's expensive. You can get glutathione IV. It's even more expensive. I mean, I actually don't even think it's reasonable unless you're wealthy and you have time to go in and every couple of weeks get an infusion of glutathione. So while we talked about diet, you can get those foods in. There is a nice cheat if you want to try to make glutathione using a molecule called NAC. Some of you might already be familiar with this, N-acetylcysteine. That's a molecule that we can easily convert to glutathione. So I call that like the poor man's glutathione. So some people use it, although, I'm kind of a food first kind of a person. So you have options there. And anything that you can do to boost antioxidants in the body is a good thing. And we should be doing that as a non-pharmaceutical approach to multiple sclerosis.
Thank you. Good answer. Susan's asking, are there any problems if she were to take ALA with thyroid disease?
Okay, I'm assuming ALA is alpha lipoic acid, which is another antioxidant, and I am not aware of issues with thyroid disease. And I do have patients, lots of patients with thyroid disease who are, taking alpha lipoic acid, so I'm not aware of any interactions.
Thank you. Elizabeth would like to know if you have any thoughts on creatine for MS energy and muscle strength.
Yeah. Hi, Elizabeth. I know who you
Mhm.
are. So creatine, there's some emerging data in this space on using creatine for building muscle, but I think a lot of us go straight to the supplements. Like if you really want to build muscle, which is super important for MS, it's actually important for everything, even if you have no chronic diseases and you're aging, which is all of us. As we get into midlife and beyond, it actually gets harder and harder to make muscle. So anything we can do to make muscle is worth doing. So yes, you could probably use creatine, but my recommendation for building muscle strength is strength training, making sure you're getting enough protein. A lot of us are not getting protein, especially if we're plant-based, vegan, vegetarian. If and also the timing of protein is really important. If you're going to do strength training to build muscle, you'll want to make sure you have some protein on board before you do that strength training. Maybe get like 20 to 30 grams of protein in. I know a lot of people want to do their exercise in the morning on an empty stomach because they're fasting. I would just delay your strength training until you've eaten because you want to have building blocks there to build muscle. For women, it's really important to um, eat protein within an hour of strength training. And then just real quick, while we're talking on the topic of muscles, because I want to make sure we're giving a comprehensive answer here. The most important time to get protein in you is with your first and last meal of the day. Last meal of the day, you want to have protein because you're going into an overnight fast. Your bodies want to do this work of repair, and you want to have those building molecules around so you can do the repair. And then in the morning, you're coming out of a fast, you've used up all your building blocks. So you'll want to do this metabolic correction of putting more protein in. So like having a piece of toast with butter isn't really helpful in the morning to break your fast. So think about protein, prioritize that, strength training. And then if you're still not making enough muscle, you can consider supplements like creatine.
Mm, I want to jot all this down, but I know we have a recording of it, so I don't have to. Deepa would like to know, is red and near infrared light therapy helpful in mitigating pain and fatigue in MS?
Great question. I get this red light question a lot, not a lot of data. Probably the most convincing data I've seen, which is not a lot of data, is for Hashimoto's disease and the autoimmune thyroid dysfunction. There's some data that using red light can drop the number of antibodies floating around. I haven't seen data for pain and fatigue that's convincing, but red light therapy is really safe. If you can afford the device and you want to use it, you can. I have had patients use it for neuropathy and other types of pain. I actually own a device, and it's hit or miss. Sometimes it helps with pain, sometimes it doesn't. But is it worth trying? Yes, if you can, if you have it, you want to use it, fine. But it can also be expensive. So I usually don't recommend a lot of expensive things to people unless there's a lot of data. But anecdotally, I have heard patients say that it helps with pain. I haven't heard that it helps with fatigue.
Mm, thank you. Carmelita would like to know, is there really any inflammation diet? And if so, what are your thoughts?
This is a good question because there's so much information online. It's actually impossible as a layperson to sort through it, and everybody's trying to sell you something. So I'm going to just break it down to you and give it to you straight, like you were my family member, which, like, I would always do that anyways. Anytime you eat real food, and mostly plants, and you avoid junk and sugar, that's an anti-inflammatory diet. You can call it a Mediterranean diet. You can call it the Walls diet. You can call it the Swank diet. It doesn't matter. What they all have in common is that you're eating real food. So you're not eating processed packaged foods. Those molecules are artificial. There was just a large meta-analysis where they pooled data from lots and lots of different studies looking at what is the impact of ultra processed foods. And we are seeing that countries that have the highest consumption of these ultra processed foods have higher death rates. And we're like right there on top because, we like to be at the top of that. So, um, eat real food as close as it grows to nature. Eat mostly plants because that's where a lot of the vitamins and minerals and those colorful phytonutrient molecules come from. That's where your antioxidants are. Flood yourself with those molecules. And when I say mostly plants, if I had to give you a visual, I'd say if you have your plate in front of you, look at what's covering your plate. Is at least 75, 80% of it plants and is maybe no more than 20% of what's on the surface area of your plate, animal products, which I would lump, eggs and dairy into as well. And, some other nutritional strategies are, eat organic and non-GMO as much as possible. No one's going to do 100% because when we eat pesticides and herbicides and weird genetically modified foods, these are artificial molecules our bodies weren't supposed to come in contact with. So they can increase inflammation. Sugar, really, there's no nutritional value in sugar, and it doesn't make you go look for broccoli. It makes you go look for more sugar. So the main two things are mostly plants and real food, and that'll be your anti-inflammatory diet. One other thing I always like to tell everybody is eat all the colors of the rainbow every day. Think about what you're missing and go get that color and eat it. For most people, it's purple.
Hmm. Purple carrots are pretty cool.
Yeah.
I like those. Not you don't find them very often, but they're pretty cool when you get them.
Right.
So, which is better for MS? Collagen peptides powder drink mix or protein powder drink mix?
Okay, I think I have a clear answer to this one. I have been learning about protein from some protein experts, and collagen probably is not as helpful, although some people swear by it, they love it, they take it. You don't have to stop taking it if you love it, but it's not going to be the thing that's going to help you boost your protein status. And for a lot of us who are not getting protein, like this is the one place where I'm like, if you can't hit your protein minimum, get a protein powder, especially if you're trying to build muscle. So, protein powders, they're not all the same. You want to definitely read the ingredients. If you are trying to build muscle, you want to go for one of these building blocks of protein. They're called amino acids. There's an amino acid called isoleucine. And if you're buying a protein powder, go for whey, which is dairy based, either whey based, pea protein, or hemp. Those are the three best types of protein powders that are going to have enough isoleucine to help you build muscle.
Thank you. Someone's asking me, and I'm not sure, maybe you understand it, but they said, please list the spelling of the items being discussed. Well, we've discussed a lot. So,
Okay, I'll try to put whatever I can think of here that we've talked about. Um, I guess they can't see the questions, can they?
I'm not sure. Bobby, can everybody see the questions? I don't really know.
Okay, I'm
But
just putting down all the molecules we talked about. Yeah.
yeah.
Okay. Let's keep going. I can type and
Okay.
talk at the
You can
same
do two
time,
things
I
at
think.
once. Okay. Karen wants to know, is there a list of vitamins with doses that you would prescribe? Her first MS neurologist gave her a list 26 years ago. And over the years, she's had different neurologists and no longer have the original list. That initial doctor has passed away, so she can't get it. So, um, is there
I
really
will.
a list somewhere of the vitamins?
I bet you if you put 100 doctors and ask them for the list, they would all be different. But I'll tell you how I approach it. I really try to just practice common sense medicine, and the non-negotiable is vitamin D. You got to have a good vitamin D. I can only count on my like one hand the number of patients I've had over the years that had a good therapeutic level of vitamin D in blood when we checked and they were not on a supplement. So just about everybody needs to be on vitamin D, and I would go for vitamin D3, and I'll type this. And I'm going to tell you my target goal. Please, obviously, talk to your doctors about what's the right target goal for you, but I generally go for 50 to 60 nanograms per deciliter in blood when we check your total vitamin D level. For some people, it might make sense to push that up to 80. right? People who have kidney stones, problems with phosphorus or calcium metabolism, kidney stones should not get their vitamin D levels above 60. So I think 50 to 60 is a range that works for most people, even if you have osteopenia, osteoporosis. But please talk to your doctor about what the right range for you is. But I think everyone should be on a D3. Most people are like hanging out in the 20s when we check, or 30s. Like that's too low. The immune system falls apart. We want to get the immune system to be more regulated and to follow the rules better. Um, then I would say omega-3. Usually we think of that as fish oil. For people who don't want to do fish, you could do algae, but it's a lot more expensive and not as efficient. But we can't get enough omega-3 from diet. And omega-3 is really anti-inflammatory. So, dosing is kind of all over the place. I'm going to write this down. You guys can see this, I think. I'm going to talk as I type. Let's see, omega-3. I'm going to say add up the amount of EPA and DHA per serving, and that'll give you the amount that you're getting in each capsule or in a teaspoon. I'm going to just put general numbers out there, but I do not know anybody's medical histories here. So please talk to your doctors. A very low dose is when you add up the EPA and DHA together, and in one serving, you're getting, together you're getting 500 to 1,000 milligrams. That's a low dose. 2,000 milligrams, I'd say, is like a good maintenance dose. Sometimes when people are in a flare of their autoimmune disease or an inflammatory disease, you might push that up to 3 to 4,000 milligrams of omega-3, which would be the EPA plus DHA. People take Vasepa, which is available by um, prescription. That's 4,000 milligrams, and so, we don't worry about the blood thinning effects of omega-3s anymore. People worry about mercury. Get a good product where they remove the contaminants. I don't think I can talk about brands here, but I would say omega-3 and then other supplements. Usually we all have holes in our diet, so a good multivitamin, multi-mineral would be helpful. And then I'd say a B complex. I just see a lot of people low in B12, B6, and a lot of these molecules are important for nerve function, brain function, everything. They're such central molecules. Beyond that, I don't have a list that I give everybody. It's like you got to have a reason to be on other things. So I'd say those are my top four things. The vitamin D, the omega-3, like a broad spectrum, I'm writing this, multivitamin, multi-mineral, and then a B12. Sorry, I can't type.
Okay.
Okay,
I'm excited to tell everybody that although it's going to be here in a couple weeks, this will actually be on our YouTube channel, and you'll be able to go through it very slowly if you want and jot down all your notes and write it again. And so there's no real rush. If you don't have paper and pen near you, it's okay. You'll be able to get the information again, thankfully. So
great. And sorry, I
thank you.
just want to correct what I said. I said B12, I meant B complex, but everybody should have their pulse on what their B12 level is too.
Perfect.
Go ahead.
Deborah would like to know if mild asthma can cause a worsening of walking ability.
Yeah. Hi, Deborah. So, asthma is where we can't exchange oxygen and breathe out carbon dioxide. And, I would say the connection with that would be maybe if you are in the middle of an asthma attack, you're obviously not oxygenated as well. And that could affect your walking ability. Or if at baseline, you're just not great at oxygenating. But other than that, I can't think of a direct connection where asthma, if it's stable and you're not having an asthma attack, why that would affect your walking ability.
Thank you. We have a question from someone who's raised their hand, so I'm going to see if Lane, let's see, Lane. Okay, Lane, I'm going to ask you to unmute yourself.
Can you hear me now?
Perfectly.
Good afternoon. I take isotonics daily. I also take something called black seed oil, which is cold press. It says on the container black cumin seed oil. It's been very helpful for me. And vitamin D is very big, as she said. I don't know if anybody's aware of black seed oil. It's very helpful and beneficial. Plus, I take turmeric and black pepper in my eggs, and I eat that. The turmeric helps the pain in my feet.
Nice.
That's wonderful. That's a nice array of things that people like. I don't have a lot of experience with black pepper. I mean, I'm sorry, the black seed oil, but I do have patients who use it and love it. I do use turmeric quite a bit in my practice for people who have pain, inflammation. It can't, it's really well studied. So, you know, definitely have it as the food, as the powder. And if you do need to use it for a period of time for inflammation and pain, it can be helpful.
Mm. Thanks, Lane. Also, it's nice to see your face. I haven't hear your voice because I haven't seen your face in a couple years. So,
Likewise.
bye. Thank you. Bye bye. Okay, let's see. Let's go to our next one. And that is, what supplements do you recommend in addition to diet? This is Caroline asking.
Well, I think that just goes back to the vitamin D3. By the way, you know, some people take vitamin D2. That's fine. A D3 just has a longer half-life, and I just prefer it. It's dosed daily usually. The omega-3, the multivitamin, and a B complex.
Okay, thank you. And thank you, Michelle, for letting us know that the attendees cannot see the questions. So that answers that question. Sandra would like to know, nope, that was just about the closed caption. Alex said mushroom coffee, Rise brand.
Yeah, I have yet to try that Rise brand. It was a little bit expensive, but I have heard from people that they enjoy it as a drink, and I have had patients use mushroom coffees um, to as a substitute when they're trying to get off of caffeine. Which, you know, I don't. I just want to say a quick thing about caffeine. There's nothing, you know. As long as you're just having caffeine here and there and it's social and you enjoy a warm drink, fine. But where it becomes problematic is when you can't get going in the morning because you need to have the caffeine or you're using it to treat fatigue. I get it. Like, you know, you just need to get things done and you need a little boost of energy. The problem is that there's always a crash and you're going to need more. So you end up in this cycle where you constantly just need to keep medicating yourself with it. So if you're trying to get off of coffee, I think mushroom coffees are wonderful. Also, mushrooms are just really magical. They have a lot of beneficial properties for the immune system. Getting them as like a mushroom tea or a mushroom coffee is a nice way to get started. Some people kind of start there as they work their way up to bigger, more powerful mushrooms. And, you know, we do worry about mushrooms kind of being a little bit unpredictable on their effects on the immune system. They're immune modulatory. And that means they can either dial up the immune system or dial down the immune system. And sometimes, as a doctor, I can't predict what's going to happen. So the judicious way of dealing with mushrooms is just to start slow, take them long term. Usually, the longer you take them, the better they work. And don't forget to eat them as food also. Just make sure you always cook them because we can't break down their cell walls.
Hmm, interesting. Desiree said, not only is this an excellent live stream, but what about the protein supplements and risks of constipation? Should we up our water fluid intake?
I don't know that protein supplements, I'm guessing you mean protein powders. I don't know that they really cause constipation, but it's always a good idea to up your fluid and water intake, especially if you're starting to eat more fiber in your diet, because otherwise you can get more constipated if you're eating more fiber without upping the fluids. Um, so yeah, just if you're buying a protein powder, check the ingredients, make sure that, you know, there's not a lot of sugar and weird stuff in there. And obviously always go for food first, but I do think sometimes you just need the additional support. Especially if, you know, I treat a lot of patients with fatigue, like MS fatigue, but I also have a lot of patients with chronic fatigue syndrome. And upping the protein helps because once people start looking at the protein content in their diet, they're like, oh my gosh, I'm just not getting enough. So we up that. And can I give like a quick, like guidelines around protein? Because this is like a big question. Okay, for protein, let me try see if I can type this as I talk. Your rough minimum is going to be minimum protein is going to be 1/3 of your weight in pounds. If you're 150 pounds, a third of that is 50 grams of protein is your minimum, okay? But what you actually probably need is double that. So maybe like 100 grams a day. It is not that easy to get to 100 grams of protein a day, and that is why you probably need a protein powder. And what I'm learning is that elite athletes need a lot of protein, but guess who else needs a lot of protein? Older people who are sedentary and overweight. I can't get into the reasons because there's a lot of pathophysiology and mechanisms there, but you're just going to have to put more protein into the system to be able to make muscle. So what there are food trackers online, and if I can mention a brand, not a brand, but a website.
Sure.
Yeah. Okay. So Chronometer is a wonderful website and app, and just for you know what I do? I just take pictures of my food on just random days all day long, and then at the end of the day, I'll spend 5-10 minutes logging it. It's a little tedious, but it's doable. And then it's eye-opening. You'll be like, I'm not even close. So I'd love for you to start getting on top of protein because it does help with energy. What was the
Awesome.
question? What were we talking about?
I
Oh, protein powders and constipation. That's what it was. So I think we answered that.
and water is the key, right? Water.
Water is
Yes.
the key.
So, Laura wants to know if you have to take vitamin K with D.
Do you have to take it? You don't have to take it, but a recommendation is if you're over 40, age 40, it probably helps to take a vitamin K with your vitamin D. And the reason is that vitamin D helps us absorb calcium from the gut into the body. And we want that calcium to go into bones and teeth and not blood vessels, not in the lining of your blood vessels. Maybe some of you have had done some imaging and it says like calcification in the blood vessels. You don't want that. So taking that vitamin K, vitamin K2 can help with directing calcium from the gut into bones and teeth and away from blood vessels. So it's like
Hmm,
100 to 200 micrograms a day is usually what it is. Oftentimes it comes with your vitamin D, like in the same product, or you could buy them separately if you need to.
perfect. Carmelita would like to know what about holistic or herbal tinctures like ginkgo biloba or turmeric?
I don't use a lot of ginkgo in my practice. I know a lot of people like swear by it from memory. Can you use it? Yes, you can. It is a slight blood thinner, so please be careful if you're on other medications that are blood thinners. Um, and then turmeric, as I said, I actually use quite a bit of that for people who have inflammation, pain, um, and it seems to help when people don't want to do medications.
Thank you. Is flax okay for omega 3s?
No. So it does contain omega-3. However, there are many different kinds of omega-3 fats, and alpha-linolenic acid in flax is just one type of omega-3. And in the biochemical pathway, only about 5 to 10% of the omega-3 from flax gets converted down to EPA and DHA. And that's what you're really after because those are the two potent molecules that are going to lower inflammation. So if you're really going for an anti-inflammatory effect, I would just go straight for the EPA and DHA and take a fish oil or algae if you're a vegetarian. I think you should still take flax because it's a good source of protein, vitamins, and minerals. Um, and by the way, with flax, it's the only seed I would say you should grind because otherwise it'll just go through you like fiber. You won't be able to release like the beneficial molecules like the lignans and things like that in there if you swallow the flaxseed whole. Also, don't buy it ground up because once it's ground up and exposed to oxygen, all of the good stuff kind of dies. So you got to have a little coffee grinder and just grind your own flax seeds for a few days, keep them in the fridge and add it to smoothies, salads, or whatever you like to use it for.
So the flax seeds that are in a lot of breads, those are useless, right? If
I
because they're not
mean,
ground.
right. If it's not ground, it's just fiber. So it has that effect, but you're not getting all that good stuff inside the seed. Our GI tract can't break it down.
Thank you. Mary said that many of us have bladder issues, some with a suprapubic catheter. Do you have any thoughts on bladder health, like avoiding oxalates, supplements to avoid infection, things like that?
Yes. So if you don't react to oxalate foods, which are like found widely in plant-based foods, like spinach, for example, I don't think you have to avoid them, right? And I always want people on the most diverse diet that they can be on. Um, Supplements, I mean, for infections, of course, D-mannose is a supplement that can kind of prevent the bacteria from attaching onto the wall of the bladder. Cranberry, you can either get some unsweetened cranberry juice and drink 4 ounces a day, something like that. Or you could do cranberry as a supplement. So those can help. What else? For bladder pain, there are supplements that are called, well, they're plants called demulcents. I'll write that in the chat so you guys can see what that looks like. These are, and let me put some examples. Demulcents. This would be like marshmallow root, slippery elm, DGL. And one thing to know about these is that they uh, let's see, they interact with many medications. So you'll need to ask don't ask your doctor won't know. Ask your pharmacist if they interact with your medications. It's not a fair thing to ask your neurologist because they're going to be like, I don't even know what DGL is. It's not their job to know what DGL is. Anyways, I put the name of some demulcents in there: marshmallow root, slippery elm, DGL, which is licorice. Um, these, when you take them, they sort of create a white milky fluid that coats your urinary tract, but also your respiratory tract and GI tract. So it just soothes those tissues. You can take these 2 to 3 times a day. I like marshmallow root powder that you mix in water and drink it. But just talk to your pharmacist to make sure it doesn't interact with some of these big gun immune medications that we're on.
Hmm. Sharon says, how does she know if what she chooses is a good supplement?
Okay, I'm assuming I can say the name of this website called
Yes.
consumerlab.com. Okay.
This is all about education. We don't
Okay.
care what you bring
Well,
up.
yeah. So I believe products pay to be tested by Consumer Lab. It is not something, it's not free. The annual membership is about, I don't know, maybe 90 or $100 a year, but like at Stanford, if patients go into the health library, they can have access to it for free. So academic institutions might have access to it for free, also public libraries. And when I pull like protein powders, people are always asking me like, what's the brand? I have to go by data, right? Like I can't look at a package and say, oh, that looks good, because there's a lot of money that's put into that packaging and the marketing. So Consumer Lab has done um, testing and comparison of a lot of different products. And what's really nice is that they also do the cost analysis. So you can actually find supplements that are not that expensive, that are probably better than some of the more expensive things on the market because what's on the label is accurate. They've tested for contaminants. So I would just go to consumerlab.com and either pay for it or find a way to get it for free.
Thank you. Karen says, if I'm sick, it greatly affects my ability to walk. I take vitamin C daily. What else can I take that would help the cold upper respiratory infection go away?
Great. Vitamin C is an antioxidant, right? Like alpha lipoic acid and glutathione that we talked about earlier. And so, right, it makes sense, right? When you're sick, there's more stress on the body. There's a lot happening at the molecular level. So you want to have more antioxidants. Um, there's so many herbs out there that people take. During COVID, like elderberry, these things have antiviral activity. Vitamin D is actually pretty potent as an antimicrobial. I have heard of, naturopathic protocols where people taking, giant doses of vitamin D3 for 3 days, just for that antimicrobial, antiviral activity. Um, so, to be honest with you, in my household, I don't have any of those things at home. It's like rest, sleep, drink water, eat simple food, and just let it work its way through you. Um, but we take a lot of vitamins and supplements, hoping that it helps, but I just don't know that it's really as reliable. But I get it, Karen, that like you need to maintain your ability to walk. So anything you can do to keep your immune system strong would be helpful. It goes back to vitamin D and omega-3.
Thank you. Great answer. Caroline would like to know, is there an actual test that you can take to measure a level of inflammation?
Man, I wish somebody would make a really good test, but I'll put down the two that we use in clinical practice. It's ESR, which is erythrocyte sedimentation rate, and C-reactive protein. They are not highly specific or sensitive. You might order them on a patient and they might be positive. If they're positive, yeah, they've probably got inflammation. But if they're negative, I don't think it rules it out. Like, how often have I had patients with inflammatory conditions in a flare and their ESR and CRP are negative? So those are the two tests that we can look at, your regular doctors can order. Now, you could go into functional testing, getting functional labs. These are different companies. They're not offered at like Quest and other places. And they do have to be interpreted by someone who understands how to interpret them. If you take that to your regular doctor, they won't know what to do with it. I mean, I've had to spend a lot of time learning how to do that. That can give you ideas of like inflammation in the GI tract and other metabolic information that might help kind of put together the picture, but a lot of times I'm not covered by insurance. And it's not the first thing I would do. I know we all want to see what the numbers look like, but as a clinician, I can tell you, I look at a person and I'm like, I know you need gut support. We need to support your immune system. We got to build up your gut microbiome. I don't need a test to tell me that. I usually have people test when they've done a bunch of things, behavioral and food and lifestyle strategies, and they're just not sure what to do next. That would be a good time to go get tested. So squeeze out as much as you can from diet and lifestyle and then go get tested.
Great answer. Okay. What do you think about boswellic acid?
I don't know what that is. Is that like Boswellia? Let me look it up really quick. Um, Okay, I think it's basically frankincense. Yeah, again, it's not one that I use in my practice. I do actually have essential oils like that I just use at home. And frankincense, or I think boswellic acid probably is that, can have anti-inflammatory effects. I'm just being honest when I say I've never seen a supplement by itself turn things around. Like it's like diet and lifestyle are your foundation and the supplements are a supplement to your behavioral strategies.
Makes sense. Um, I think we've actually already answered this, but you can tell me, can D3 be absorbed without K2?
Yes. K2 is trying to figure out how to push calcium into bones and teeth. So, yes.
Okay. And what about lion's mane mushrooms? Are they okay?
Yeah, lion's mane, I would say, is a more powerful mushroom. Um, People say that it helps with cognitive function, brain fog, memory. It's not one where I would start with, it's a stronger one. So I'd start with something really simple. There is a product that I like by Host Defense, and there's many. This is not the only one out there, but it's called Stamets 7. And this is a mix of like 7 different mushrooms. It's pretty easy to take, pretty safe. Start at a low dose if you're sensitive. Work your way up with mushrooms. Don't go straight to the big gun mushrooms because we just want to be careful, right? I don't know how you're going to respond, so take it easy.
Mm. And Lo wants to know, what about dairy and fermented vegetables?
Okay, I'm assuming your question is it okay to have dairy? It's a lot of benefits to dairy. It's got, um, calcium, there's good protein there. A lot of people do have sensitivities to dairy. So if that is you, then you probably want to minimize dairy in your diet if your immune system is reacting against it. A lot of us with MS who have autoimmunity have a lot of food sensitivities as well. So if you continue eating a food that you have a sensitivity to, and your immune system, every time it sees dairy, it's pouring out antibodies. That's not helping your situation. You want to calm the immune system down. So abstaining from dairy can be helpful. This is done through an elimination diet. Maybe a topic for another time. But there is a way to methodically like take that food out for 3 to 6 weeks, see how you feel, and then reintroduce it back. Over 3 days and see if you react to it. So, and dairy that's fermented, like kefir, cheese, yogurt, has that added benefit of having the good bugs, the probiotics in it. So, and I know a lot of people who react to milk can tolerate fermented dairy. So, if you tolerate it, fine. I also think that elimination diet is better than doing the blood testing for food sensitivities, which is less accurate. Okay, what about fermented vegetables? Love them. I mean, they should be a part of our diet every day. These are foods that our ancestors ate because they don't need refrigeration. They can last for a long time. So that's where all the good bugs are. So I hope everybody can have maybe 3 or 4 different fermented foods in your fridge, and you just start with the little teaspoon a day and have it as a side dish. So I love any kind of fermented vegetable. And by the way, fermentation is done with salt. If it's vinegar, that's pickling, which is a little bit different. It doesn't have as much living organisms. You want to just go for the big guns. Go get the fermentation products with salt.
Do the people who are possibly that have high blood pressure that need to limit their salt, does the fermented vegetables that are done with salt affect that?
Yeah, I mean, if you are salt sensitive, and not everybody with high blood pressure is, but if you are, then you need to limit it. You could try some of the cheeses or do kombucha, which is fermented tea. That's a different fermentation process, and it doesn't have salt in it.
Thank you. Roberta wants to know, what do you think about propionate?
I don't know what that is.
Propionate.
I'm looking it up. It's a chem. Oh, okay. I guess it's a chemical. Um, it's a gut metabolite or a food preservative. So I don't really know what it is.
Okay.
If Roberto can tell us, then we can answer it.
Okie dokie. Well, Karen said at MS diagnosis, her B6 blood level was at 143.4, which scared her doctor. She had been taking a B complex and stopped, but the level stayed high for several years. Have you ever heard of this?
I don't think I've heard of that with vitamin B6. I've seen it quite a bit with vitamin B12 where people just have elevated levels. And if you stopped your B6 and like it shouldn't stay high very long. It should be down within a few weeks. Um, I would think that there's probably another reason for it. And I don't know if this is true for B6, but I know for B12, sometimes if you don't have a good healthy gut microbiome, some of these bacteria can overproduce vitamin B12. I just wonder if that's maybe a similar mechanism for an elevated B6. So the answer would be working on gut health to get the good bugs in and make it harder for the not so friendly bugs to grow. And one thing with elevated B6 levels, sometimes we see like a neuropathy-like syndrome. People kind of get weird neuropathic symptoms in their hands and feet. So, I don't know if that was part of what you experienced, Karen, but if you're not on supplementation and your levels continue staying high, I don't know. I think it's worth thinking about it, but I don't know that I would be alarmed about it.
Thank you. And Kristen is asking, what's the easiest way to incorporate turmeric into her diet?
Sure. Great question. So I like turmeric paste. I'm just going to write this in the chat. And recipes are online. Basically, it's turmeric and water mixed over low heat on with some coconut oil. What I do is I have like a 1950s ice cube tray, like it's all stainless steel. I dump that solution in there after I've mixed it. And then I have little cubes of turmeric paste and I can put it into a smoothie. I put it into my coffee. What else do I do with it? You can actually, melt it out and cook with it. So I like turmeric paste. Turmeric root, I just chop it up and sometimes saute with it, just like I would with ginger. or I chop it up and put it in hot water and like make a tea out of it. I also put ginger and lemon and maybe a little bit of honey. So that's
Mm.
another way to get turmeric in. Um, what else? The powder you can use basically like a spice in many things. I love turmeric on eggs. It's actually my obsession. Leeks, eggs, and turmeric. That's like my jam right there.
Oh, I love that. So, what do you think about, and I know I'm going to mess this up, Aloysia citriodora herbal remedy?
I don't think anything about it because I don't know what it is. I'm literally looking up. Oh, it's lemon verbena. Okay. Let's see. What do I know about this? I actually don't know too much about it. I don't think this is the same as lemon balm. So it's not one that I use in my practice very much. Is it used for its scent as aromatherapy? I'm a huge fan of aromatherapy as long as people aren't sensitive to the scents, but sorry, I wish I knew more about it, but I don't.
Okay. What do you think about Nigella sativa oil?
Yeah, is that black seed oil? I think it might be. Again, people use it for pain. They use it to if I'm not talking about the wrong thing, but topically for like a painful knee, as an anti-inflammatory pain reliever. I think that's how that's used.
Okay. And Christine says, Hi, I know that you said you can't mention brands for supplements, but do you still recommend buying brands with the USP label?
Yeah, I think it's helpful to have some kind of certification. USP is one of them that you can look for if you don't have access, for example, to Consumer Lab.
Okay. And Sherry says, What about oregano and black seed for MS with menopause?
I can't think of a reason why you can't do them. I can't, I think it's fine if you wanted to do them.
Okie is algae a problem for hypothyroid?
Are you worried about, is it like as a blocker because of too much iodine? I think it's an iodine issue that she's getting at. Um, So there's algae is not the only food with iodine, like fish and sea salt that's iodized can have iodine in it. Here's the thing with thyroid function. Too little iodine can suppress thyroid function, and too much iodine can suppress thyroid function. So does it mean you can never have algae? You can. I just probably wouldn't overdo it. Same with people who are hypothyroid, who has an underactive thyroid. Same with cruciferous vegetables. This would be like your Brussels sprouts and broccoli and cauliflower. Eating a large amount of them raw can have an anti-thyroid effect, different than algae. Algae is like an iodine issue. Cruciferous vegetables can suppress thyroid a little bit. So just lightly um, steaming them inactivates those compounds and then not overdoing it with the cruciferous vegetables if you are hypothyroid.
Thank you. And so, what about fermented foods like kimchi or natto or sauerkrauts?
Sure, kimchi is fermented cabbage, natto is fermented soy, sauerkraut is fermented cabbage, I think. I love them. If you can tolerate them and eat them, they're wonderful. Sometimes people who have histamine problems, they're sensitive to histamine, they can react to these foods. They kind of get a rash or they get flushing, but they're wonderful foods to have in your diet. They will help build up your gut microbiome. They are probiotics. So you can take a supplement with bacteria, or you could just take these foods, which is going to have way more variety of bugs in them. So always food first.
Thank you. What do you think about melatonin?
I love melatonin. It is great for circadian rhythms. It can help you if you take it at the right time before bed, about 45 minutes before bed, and then go into your bedtime routine. It can actually turn on the sleep systems. Melatonin is not a sedative. It basically orchestrates the onset of sleep. It calls in all the important players. Do you need to take it every night? No, you could take it on an as needed basis. And by itself, it's not going to solve all your sleep problems. You still need to have a good bedtime routine. I like to have people get early morning light, get 30 minutes of outside light, be outside for 30 minutes before 10 a.m. Regular physical activity, whatever that looks like for you, even if someone has to passively stretch you, just moving your body, and then a bedtime routine, and then a melatonin can help.
Thank you. You're like the Energizer Bunny. I'm just throwing them at you.
Let's get them
What
all.
what do you think of N-acetylcysteine?
Yes, we talked about that earlier on after the first question. It's NAC or N-acetylcysteine.
Yes.
It's wonderful. It supports detox. Has antioxidant activity. It gets converted to glutathione. So yes, do I put everybody on it? No, but if someone wants to support detox, have more antioxidants on board, you could try it.
Okay. Karen would like to know your thoughts on probiotics and prebiotics. How should they be taken?
Okay, oh, I don't know if that means foods or supplements. I'll address both. Food first. So fermented foods would be your probiotics. Prebiotics would be foods that have the right kind of fiber that feed your good bacteria. So this would be like kiwi, banana, green leafy vegetables, onion, garlic. You ideally want to have a variety of them in your diet every day, not the same one every day. If you want to take a supplement, because you can get them in as foods, that's fine. You can do a probiotic supplement. Prebiotics, there are, multiple ones out there. Sun fiber is a common one that's really well tolerated for people who can't get enough fiber in. People also do psyllium husk. That's more just fiber, but if you really want the prebiotics, I'd go for sun fiber. And this is for protecting your gut microbiome, making sure that those bugs grow and thrive. And if you could only choose one between prebiotics and probiotics, go for the prebiotics. They have a bigger impact.
Okay, and Lynn would like to know, what do you think about Kalawala polypodium L?
I've never heard of it. I've never heard of it. I'm so sorry. I've never come across it. I wish I knew, and I'm cheating here and Googling. I don't know what it is, so I can't comment on it.
It's a cool name.
It really is.
Kalawala. Okay. This is from Carol. I've been taking supplements for 25 years. Does my body get used to it and not use it?
With some, yes. So just like we put patients on drug holidays, you could go on a supplement holiday, but I just think that we generally take too many supplements. If there isn't a clear reason for taking a supplement, I'd probably come off of it and see if I still needed it. So there should be a clear reason for everything that you're taking.
Thank you. Christine would like to know what your opinion is on Prevagen supplement for cognitive function.
Oh, is this the I have to look these up. The jellyfish? Yeah,
Mm,
this is okay. Yes, I just had to refresh my memory. I don't think that we have real data on this. Again, I don't know if this is a lot of marketing. I just don't. The things that reliably help with brain health are movement and exercise and sleep and stress management. No supplement. I've had patients take this and they're like, oh man, it's really helping. And then a week later, they're like, it's not helping. So, I just think you got to just kind of tap into the behavior that's going to help you more than any supplement.
thank you. Where would Laura go if she wanted the best place to get a food sensitivity test? Blood prescribed by doctor.
Okay, so your regular doctors can order a blood test for IgG food sensitivities and IgE food sensitivities, which would be like um, let's see, I'm going to put this in the chat. uh, um, it's often covered by insurance. However, I just caution you, a lot of times people show up with a lot of positive tests, positive foods that light up, and then you're kind of obligated to go down the path of doing eliminations and reintroductions to see which of those you actually react to. But if you want to get a test done, you can get a food sensitivity panel by your regular doctor.
Okay. And could you explain a little bit more about gluten? Because a couple people are asking, should they be
Yep.
avoiding it? And really, what is it? So,
Got it. So gluten is a protein found in wheat, barley, rye, and some other things. We all consume a lot of gluten, and it's a protein that seems to kind of piss off the immune system a lot. And it's not just one mechanism. Like there's celiac disease, which is an autoimmune disease directed against gluten. There's non-celiac gluten sensitivity, which is pretty common, especially among people who have autoimmunity and inflammatory diseases. Does everybody need to be off of gluten? No, only the people that are reacting to it. So again, this is where the elimination diet comes in. Get off of it for ideally 6 weeks. Stop eating gluten. and then reintroduce it heavily over 3 days to see if you have a reaction. And sometimes the reaction is skin. For me, during the pandemic, when I was super stressed, my face would blow up every time I had gluten. It doesn't do it now because I've repaired my gut. And these things can change from time to time. So I don't think gluten is very nutritious, so I don't think it needs to be a big part of anybody's diet. But if you are sensitive, then I think you should probably be more mindful of avoiding it versus people who are not sensitive. They don't have to go out of their way to avoid it. So I hope that helps. But gluten and dairy are the top two foods that cause food sensitive to cause problems for people. And it's not just always skin or GI. I've seen people eat gluten and they can't walk straight. They lose their balance, brain fog, lots of different ways gluten can show up.
Mm, I know so many people that can't eat it.
Yeah.
So we are at the top of the order hour. Would you mind if we just went to a couple more questions? I'm not going to get to all of them, but we can do a couple more if you don't mind. So, but by the way, Roberto is answering. Remember, he had brought up the
Yeah.
propionate. He said
Yeah.
it's a food additive, maybe you meant that has adversely correlate with MS diagnosis and
Yeah.
historical data used to make bread fluffy with a protective unexpected effect. A precursor of ibuprofen sold in Germany. His friend uses it. So,
Yeah. I don't know. I don't like anything that's fake or weird.
yeah. So, what are your thoughts on adding hemp seeds to diet?
Hemp seeds are wonderful. You don't have to grind them down. Again, a good source of protein as well as vitamins and minerals. I suggest just making a seed jar. I have any seed I can get my hands on. I just throw it in the jar, mix it up, and then it's ready to go for salads, for smoothies, for open-faced sandwiches. Um, there's lots of ways to use them, and they're really underutilized. It's a plant food that's actually they're almost complete proteins, hemp and chia, because they contain a lot of the 20 many of the 20 amino acids in them in one plant-based food, so really helpful to have seeds in the diet.
Okay, and I am going to do one more because I want to know the answer. Is it safe to use soursop bitters?
I mean, okay, so bitters are plants that actually taste bitter and they can help the body secrete more bile and help with digestion of fat. I don't know what soursop specifically is, but I am a fan of bitters. And you can buy them in supplement form, but you can also eat them as food, like dandelion root. Coffee is considered a bitter, and there are like little tinctures that you can use. So they can help with digestion.
Okay. And dark chocolate? Somebody asked about dark
100%.
chocolate.
Okay, so yeah, a little square inch of dark chocolate every day is awesome to have. It's a rich source of antioxidants and some good fats. You just want to get one that doesn't have a lot of sugar and artificial products in it.
Thank you. And that does bring us to the end of our time. Unfortunately, I wish we could go on for the next 5 hours with you. But if you missed any part of this conference, it has been recorded and it will be available through the MS Focus Facebook and YouTube channels. Just reply to your registration email for information on how to access the recordings or to sign up for our newsletter to learn about the upcoming events. Please join us for our next teleconference, which is going to be next Tuesday, September 2nd at 3 o'clock p.m. when Sherry Binns, who also, by the way, has MS and she is an MS certified nurse, she's going to be doing her 60-minute Q&A. She does that every other month and she answers all your questions about symptom management. So as you leave the conference today, a survey will appear on your screen. We would ask that you just take that moment to fill it out because it's going to tell us what's important to you. And so that's what we want to provide for you for the next programs. Our sincere thanks to all of our attendees for your participation and especially to Dr. Payrovi for sharing your time and expertise with all of us. Have a great evening, everyone, and we hope to see you back again, Dr. Payrovi. You are outrageously, incredibly unique. So thank you, and we look forward to seeing everybody again. Have a great night.